Hi everyone, I am Shatakshi. I am a women health physiotherapist and I talk about pregnancy in my channel Preganest. I have a question for you. What is that one thing that you fear about most during the labor? Tell me. I'm pretty sure a lot of you will answer the pain. And rightly so, because in a lot of movies and TV series we see the women screaming on top of their lungs, and also our friends, our grandmothers, our aunts. Since we were children, we have always heard that labor is very painful, and somewhere that has stayed in our minds. And when we come towards the end of our term, the pain and the thought of labor somehow scares us. Is that right? So today we are going to discuss some interventions that can be used to decrease the intensity of pain during the labor and to make your labor more comfortable and more happier for you. The first one that we are going to talk about is the TENS. TENS stands for Transcutaneous Electrical Nerve Stimulation. So this is the traditional TENS. You have to plug it in the electrical socket to start the machine. This is a battery operated device. This is a shorter form of this machine, and you have to just stick the electrodes on your back and increase or decrease the intensity. You have to increase or decrease the intensity in both the devices, but the only difference is the traditional TENS is bigger and it needs a socket to get connected. It basically works on the principle of pain gate theory, due to which it subsides the pain and increases the release of endorphins and also provides a massaging effect along with reducing the pain. Now the question arises that, is it safe? Yes, it's safe and it can be used in any stage of the labor. Now the contraindications of TENS: it should not be used if you have any open wounds on the part where the TENS is being placed. It should not be used if you have a pacemaker and any metal on the part where it is being placed. Another thing is that it cannot be used in the water. So if you are planning to give birth inside the water, or if you are planning to have water birth, then it won't be possible to use TENS. Next pain management intervention that we can use is the nitrous oxide. Do you know what nitrous oxide is? It's laughing gas. So the hospital will give you a cylinder filled with nitrous oxide and you will be given a mask. Same thing as TENS, it can be used in any stage of labor. You just need to bring the mask and place it on your nose and inhale that gas. So that gas provides a very euphoric effect and very calming effect and also decreases the intensity of your pain. So this is laughing gas. Now the cons of nitrous oxide are that you need to bring the mask to your face every time you try to inhale that gas, so it becomes quite irritating for the women in labor, as there is a lot of hormonal play and she's already irritated, and sometimes nitrous oxide might cause nausea. So these are the cons of nitrous oxide. Now the third thing that we are going to discuss is the epidural. So epidural is a type of anesthesia. It is given in your back and it is only given when you are 2 to 8 centimeters dilated. You can correct me if I'm wrong. And the epidural also decreases the pain and it takes around 20 to 30 minutes to show its effect, and if you want to take another shot of epidural, if the pain comes back after let's say 2 hours or 3 hours, you can ask for another shot of epidural also. The epidural decreases the pain, but you will feel the contractions. You will feel that something is happening in your lower body. You will get all the sensations of the movement, the contractions, but you won't feel the pain. Isn't it amazing? So this is how the epidural works. Some of the side effects of epidural are headache, itching, nausea, and some women feel shivering after taking the epidural. So this is all about the interventions that can be used during the labor. I have not gone in very detail in all of these. If you want me to cover each one in detail, you can always let me know in the comment box. In the next part, I'll be sharing some of the techniques that you can do on your own. So till then, take care and bye-bye.